Hi, very good morning to you. Um, to tell you frankly, when Maya discussed the debate topics with me, I misheard it as secondary glaucomas, and imagine my plight when, just few days back I realized my mistake. So I took up the challenge, and because again, honestly, even I wouldn't prefer doing a tube in a, as a first line treatment in a primary glaucoma. But then I thought of doing some literature search, and Prashant, I'll give it to you, I think, in this topic. I'm just here to discuss and just discuss few studies which have been published previously, and we'll then probably have a discussion after this. So the use of glaucoma implants were limited usually, in cases where trabeculectomy has failed or in case of refractory secondary glaucomas. But with time, the indications for tubes have become a little less restrictive. So for this debate topic, I had 2 points to ponder. There were 2 aspects to it. One was it should be a primary procedure, and secondly, it should be a primary glaucoma. So I looked up the studies, and this was one study, tube versus trabeculectomy, a famous study. But again, the cases which were included in this were already secondary to an incisional surgery. So I had to do away with it. Came across the PTVT study, the primary tube versus trabeculectomy study. So here we have 242 eyes, in which 125 of them underwent tube procedures and 117 underwent trabeculectomy. So these were the pre-op diagnosis. This was the pre-op diagnosis. So in conclusion, there was lower intraocular pressure that was noted with trabeculectomy, plus there were lesser number of anti-glaucoma medications post-op, which were needed in these cases. But then the end result after 3 years was that the verdict was equivocal, and there were more serious complications after trabeculectomy post-hypotomy. So this was PTVT. The same patients were followed up for 3 years again. And again, at the end of 3 years, there were no significant difference between the surgical failure rates between the 2 groups. And trabeculectomy had a lower IOP with fewer glaucoma medications. Plus, again, the risk of hypotony-related complications were higher with trabeculectomy. So this was another study. It was a 2-centered study done in Saudi and Sri Lanka, in which all types of glaucomas were included, and they needed either a primary or a secondary trab or tube. And we did some sub-analysis. So there were 117 patients included, and 62 were randomized to trabeculectomy, 55 to implants. The mean follow-up was for around 10 months. And this was the demographic variables. So if you notice, the primary glaucomas were 83 out of these 117 cases. And if you look at the surgeries which were done, out of 75 eyes with primary procedures, 61 of them had primary disease. So trabeculectomy was performed in 35 of such eyes, and AGVs were implanted in 26 of such eyes. The post-op complications, again, were equivalent in both the eyes. So over the short term, up to 13 months follow-up, the complications and the efficacy of both the procedures were similar. The IOP lowering was greater with trabeculectomy, and success outcomes and all the other parameters were equal post-operative. So the same patients were followed up for another 31 months, and the result is the same. Lower IOP with trabeculectomy during the first year, which actually became equivalent in both the groups at the end of 31 months. No statistically significant differences between all the parameters in between the groups. So the efficacy and complications of both the procedures in a previously unoperated eye with primary glaucoma seem to be comparable for at least 3 to 4 years. And there are many factors which actually decide which procedure is preferable to a surgeon. Trabeculectomy has definitely stood the test of time. So is there time now to consider extending this offer to implant procedures as well? I would want RG sir, can you tell me whether you have operated or inserted a tube in a primary glaucoma as a first-line treatment?
Well, in 20 years.